Can erectile dysfunction or ED be cured? For a long time the answer was no, and the only option was treatment, which required continuous medication. The introduction of a medication to facilitate erections in men with vasculogenic ED offered men the chance to function sexually again without having to suffer the psychological and emotional stress associated with sexual dysfunction. However, medications do not always work for everyone, and given the choice, some patients do not want to be dependent on medication. Today, years of research into regenerative and restorative therapy have led to using shockwave therapy for the rehabilitation and treatment of the erectile tissue in men. Dr. Datesh Daneshwar, Consultant Urologist at Gleneagles Hospital Kuala Lumpur, explains further.
I've been providing this treatment for about 6 years now, and in the last 6 years I'm happy to report that I've been very happy with the results so far. I have treated close to at least 500 patients, if not more, and I have seen that if the patient is selected well, the results are close to 90% that patients will find that their erectile function will improve and will be far better than what it was pre-treatment. This is despite them being on or off medications at that time. Well, that's a good question. Now, you must understand there are many types of shock waves. You have acoustic waves, we have focused shock waves, we have radial shock waves. What is commonly used in orthopedics and in physiotherapy is radial shock waves. Now, let me explain this to you in a more layman sort of way. You know what a laser is, isn't it? We all talk about lasers, but you know there are laser pointers, there are lasers that we use to do surgeries. There are lasers that we use to actually destroy something or actually use as a weapon to break and kill someone. So every laser has got its own different property. The same way with shockwave, every shockwave does something different, and it all depends on the type of shockwave that is used. The shockwave that we use in the treatment of erectile dysfunction is focused shockwave. I was the first doctor in Southeast Asia to use the STOTS duolith focused shockwave system for the treatment of ED and prostate inflammation. And most studies have actually proven that it is focused shockwaves that actually can help with tissue and vascular regeneration and not radial shockwaves. Well, I've come up with my own treatment regime after doing this for so many years, and my treatment regime involves doing treatment over 10 sessions. The treatment is usually done twice a week, but it is quite flexible. As long as you do not miss a month in between treatments, you do not lose the cumulative effect of the repeated treatments. The treatment generally takes 10 to 15 minutes each time. And until today, there have been no reported side effects, and I have not seen any of my patients develop any bruising, any pain, or any bleeding post-procedure. So patients come in, they do the treatment, and they can actually go home without feeling a thing. That's a good question, and it's actually very subjective. It all depends on the type of patient, the degree of erectile dysfunction he has, how severe his comorbidities, meaning his diabetes, his hypertension, his heart disease is. In general, patients start seeing a change after the 4th or 5th treatment, but nevertheless, the treatment actually has a curative intent, and that comes from its stimulation of stem cells, which allow the vascularization or reopening of the blood vessels, so be it. And that can take up to 6 to 9 months to actually fully establish itself. Most of the patients will see some changes whilst they're on treatment with me, but nevertheless, the results are best usually 6 months post-treatment. Well, any patient with any type of erectile dysfunction may be suitable for this treatment. But at the moment, our guidelines strongly recommend this treatment for patients who have vasculogenic erectile dysfunction. Now, vasculogenic erectile dysfunction means erectile dysfunction because of a dysfunction in your blood circulation and blood vessels in your penis. Now, who gets this? Patients with hypertension, diabetes, previous strokes, people with established heart disease are most likely going to have a component of vascular dysfunction or blood vessel dysfunction. These are the patients who usually also do not respond very well to medications for erectile dysfunction. So now there is a curative option, or at least an option that may allow the medications to work better when the medications do not work at all.
If you or your partner are suffering from erectile dysfunction, don't be afraid. We are on your side.